Hi, I'm Dr. Mills, and I'm a psychiatrist in California with my own private practice called Freedom Psychiatry because mental health is freedom. My practice focuses on achieving mental wellness using nutrition, medications, and lifestyle changes. I will be posting videos regularly that answer common mental health questions. Today, we're answering a grab bag of questions that are all about depression.
Hi, Dr. Mills.
Hi,
I have a question that came in. How do I know if I'm depressed?
that's a great question. So there are certain symptoms that together would make what we call a diagnosis of depression or major depressive disorder. The first one is that you have to feel down or sad for 2 weeks or longer. There are other symptoms that go along with it. One of them is sleeping more or less than usual. Others are having little interest in fun activities, feeling guilty or worthless, having a decreased energy, having decreased concentration, having a change in appetite, so you're eating more or less than usual. And sometimes people feel so down or sad that they start to have thoughts like life isn't worth living or thoughts of suicide. If you are having thoughts of suicide, please call 988 911 or go to the nearest emergency room.
Thank you for answering that question, Dr. Mills. Here's another. Are some people more likely to be depressed?
So, statistically, anyone can get depression, but statistically, women are almost twice as likely to get depression than men.
Really? That is very interesting. I think depression runs in my family, and I'd like to avoid depression if I can. What can cause depression?
That is a great question. Depression is an illness that is what we call multifactorial, meaning that there's multiple causes that usually go into leading to a depressive episode. So, one of the causes is having a disruption in your chemicals or what we call neurotransmitters in your brain. Also, your genetics or what you inherit from your family, like you said, it runs in your family, that makes a big difference too. Also, having a stressful life event can contribute significantly to having a major depressive episode.
Thank you, Dr. Mills. That's great. This next question really feeds into that one. My mother recently died. How do I know if I'm just feeling sad or if I'm depressed?
Oh, that's a common one I get because it is confusing sometimes if something sad happened in your life and you are feeling sad because that's appropriate. But let's talk about the difference between when it becomes a problem that you should seek help for. So, in order for it to be a problem that you should seek help for, would be if the sadness is lasting 2 weeks or longer, and your symptoms, the ones that I talked about before with sleeping and eating, and the others, are so difficult for you that they're impairing your daily functioning. So, let's say you can't sleep and you're having a hard time going to work and being productive at work, or you're not eating and you're losing weight, those things definitely you should go and talk with someone. Or if it feels so severe, even if it's before 2 weeks, then there's no harm in going and getting checked out for sure.
Excellent. Thank you, Dr. Mills. I have one last question. Are there things I can do to get out of depression?
Yes, there are absolutely things that you can do to help yourself. Um, One of the things that some people like to do is they like to go to talk therapy. They talk with a therapist, and the therapist helps guide them to come to a place where they're feeling better emotionally. There's also what's called behavioral therapy or behavioral activation, which is where even though things aren't as fun as they used to be, you just go out and you do the activities that you used to like anyway. And at first, it won't feel like it's real exciting, and it may feel meh, but that's okay, because over time, as you keep making sure that you keep yourself active and keeping yourself within your social circle, then you'll find that it'll start to become enjoyable again. It's just so important to make sure that you have your social system there to help support you. The other thing is, sometimes people are having a hard time with depression, and doing therapy or doing the behavioral activation isn't helping enough. So that's where I come in. Well, I do come in for the behavioral activation as well, but I come in for helping you with medications. And medications can be extremely helpful and really change people's lives when you're dealing with depression and you can't feel like you can get out of it. The other thing is that if you use all three or more than just one of those treatment options, then actually the treatment's going to be more effective. So there's nothing wrong with trying multiple treatments. If you would like me to be your psychiatrist to help you with depression, please go to my website at freedom-psychiatry.com, click on the book appointment button, and schedule your free 15 minutes with me, Dr. Mills. Thank you so much for listening. Have a great day, and remember, mental health is freedom.